नमस्ते दोस्तों, सरल बात में आपका स्वागत है। दोस्तों, आज हमारे समाज में हम देख रहे हैं कि बहुत ही यंग एज में जिम करते हुए या एक्सरसाइज करते हुए लोगों को अटैक आ रहा है, विच इज वेरी डेंजरस। नॉर्मली हमें ये पता होता है कि हम जितना एक्सरसाइज करेंगे हमारी बॉडी उतनी हेल्दी रहेगी, हमारा ब्लड सर्कुलेशन उतना अच्छा होगा और उतना ही हार्ट रिलेटेड प्रॉब्लम से हम दूर रहेंगे। फिर ऐसा क्यों क्यों ऐसा हो रहा है कि जिम करते हुए या एक्सरसाइज करते हुए लोगों की जान जा रही है? इस टॉपिक पे आज हम डिस्कस करेंगे। इसके साथ ही हम डिस्कस करेंगे कि जो वेट लॉस के लिए लोग बैरेटिक सर्जरी करवाते हैं या डिफरेंट टाइप्स ऑफ प्रोटीन शेक्स लेते हैं कि उनका वेट जल्दी से जल्दी कम हो जाए, तो ये हमारे हार्ट के लिए कितना हेल्दी या अनहेल्दी है, इस टॉपिक पे भी हम डिस्कस करेंगे। और इस टॉपिक पे डिस्कस करने के लिए हमारे साथ जुड़ रहे हैं हमारे गेस्ट डॉक्टर थॉमस। डॉक्टर थॉमस एक मानवीय कार्डियोलॉजिस्ट हैं। इनका अपना खुद का अस्पताल है, होली ट्रिनिटी हॉस्पिटल, जो कि मुलुंड में है। आइए मिलते हैं डॉक्टर थॉमस से और बात करते हैं। वेलकम सर, वेलकम टू अवर शो सरल बात। सर, अभी रिसेंटली हमने देखा कि बहुत यंग एज में लोगों को अटैक आ रहा है, हार्ट अटैक। वैसे तो बोलते हैं कि एक्सरसाइज करना बहुत जरूरी है, वी शुड एक्सरसाइज एवरी डे, बट ये जो अटैक्स आए हैं एक्सरसाइज करते हुए आए, व्हाइल डूइंग जिम दे गॉट द अटैक। डज एक्सरसाइज इंक्रीज द रिस्क ऑफ हार्ट अटैक?
It's a very good question, ma'am. Let me just tell you. Normally, we tell people that that you must exercise. Don't live a sedentary life. But when we talk about exercise, what we mean to say is that you should do regular and moderate exercise. Now, mark my words. It should be regular and moderate exercise रहना चाहिए. अभी आप देखे जाएंगे तो अभी लास्ट couple of years we have seen so many prominent movie stars from different fields. You can see that most of these people who got the heart attack, they didn't even have time to reach the hospital because they died while doing an exercise. If you see most of these people, these film stars or who died, none of them were smokers and none of them were consuming alcohol or none of them had any other thing. They were all very what you say fitness freaks जो, but issue ये था कि they were overdoing that thing, going overboard, जो नहीं करना चाहिए. Because what happens when you're overdoing an exercise, then body sets into what is called inflammation. तो बहुत सारा ऐसे जो हार्मोन से पदार्थ है जो बॉडी में जनरेट करेगा, वो बॉडी के लिए हानिकारक हो जाता है. इट इज बॉडी गोज इनटू अ स्टेट ऑफ इन्फ्लेमेशन वेयर मेनी टिश्यूज, आपका जो टिश्यूज है, आपका जो नसें है, जो आर्टरीज है, वो सब है ना इन्फ्लेम्ड हो जाते हैं. इन्फ्लेम्ड हो जाएंगे तो कैसा है कि दे कैन द ब्लड स्टार्ट्स गेटिंग क्लॉटेड. दैट इज वन थिंग. Or many times what happens, these people may be having some blocks already which they do not know about. जो silent blocks जो बोलते हैं, extreme vigorous exercise में कैसा है कि ये जो blocks है, ये जो plaques जो बोलते हैं हम लोग एथेरोस्क्लेरोसिस का, जो अपना चर्बी से भरा हुआ है, वो burst हो जाते हैं. That is called plaque rupture. तो वो भी एक कारण होता है because suddenly while you're doing vigorous exercise, the pressures built up in the body and वो जो plaque है वो rupture हो जाता है and then they can this thing. Many times we have seen some of these people, they may be having some congenital problem. बोला तो पैदाइश कुछ बीमारी रहेगा जो उनको मालूम नहीं है, symptoms कुछ नहीं है या symptoms बहुत ही मामूली सा है जो which they neglected, and suddenly just recently we had one boy in the school. He was doing this tug of war event. Tug of war की event में the boy suddenly collapsed and he died on the spot. So you can see that this must have been some congenital problem which suddenly precipitated this particular thing. So overdoing any exercise is not good, but doing regular moderate exercise for your physical fitness is very good. Because extreme levels of exercise करने के टाइम में क्या होता है, कभी कभी blood pressures can overshoot and sometimes heart का जो rhythm है, जो heart का जो beats है, I have seen people suddenly going into high heartbeats. The heartbeats goes very high and sometimes they can cause what is called as arrhythmias. जो arrhythmias है कि blood का heartbeats इतना fast जाता है कि circulation maintain नहीं होता है. Because we need a normal rate, around 70 to 80 beats per minute to, or you can say the lowest is around 60 to around 100 beats तक जाएंगे तो it is good. But when the heartbeats goes beyond that, say 180, 200, 250, so heart is going at such a fast beat that there is no circulation taking place. Blood circulation ही नहीं हो पाता है. So extreme exercise में sometimes they can go, it is called as SVT, supraventricular tachycardia, or ventricular fibrillation, ventricular tachycardia. सो ऐसे जो एरिथमियास प्रेसिपिटेट होते हैं कि ब्लड सर्कुलेशन ही नहीं हो पाते एंड पेशेंट्स कैन डाई ऑन द स्पॉट देयर. देन समटाइम्स यू सी दैट दैट लेट इन द नाइट्स दे आर डूइंग एक्सरसाइज. बोला सर दिन में टाइम नहीं था, ऑड आवर्स में दे आर डूइंग एक्सरसाइज. कभी कभी कुछ लोग है ना एकदम पेट भर के खाना खाने की बात करते हैं. See, everything should have a discipline, when you're doing. So what you have to do is you should know that, after taking a heavy meal, you're not supposed to do an exercise. You should not go for running, jogging, swimming and all that. At least you should give a gap of 1 to 1.5 hours, after taking a meal. And that is why, none of the exercises should be done. So preferably you should do it on, you must have taken just a light snack or something and then do moderate exercise. एंड जो मॉडरेट एक्सरसाइज का बात है कि यू शुड डू एटलीस्ट अबाउट 4 to 5 days इन अ वीक. 1-2 दिन का गैप भी देना चाहिए बिकॉज बॉडी को रेस्ट एंड रिकवर करने के लिए. सो आई वुड ideally say that around about 7 to 7.5 hours of exercise you can do in a week. Ideal exercise would be, best exercise is to go for walking, or if you can do some swimming, cycling. All those exercises are good enough.
बहुत सारे लोग बैरिएटिक सर्जरी के लिए जाते हैं आजकल. ओके, दैट इज द इजीएस्ट ऑप्शन. आप बहुत ज्यादा वेट गेन कर गए एंड यू आर नॉट एबल टू डू डाइट, यू आर नॉट एबल टू डू एक्सरसाइज, योर शेड्यूल लाइफस्टाइल इज वेरी बिजी एंड ऑल दैट. So this has become a very easy option. So how good is this bariatric surgery when it comes to heart?
Now, this question I can take it in 2 ways. One is bariatric surgery we would recommend only for those who are what we say morbidly obese, because obesity इतना ज्यादा है कि हमको मालूम है कि because of his obesity उनका sugars are totally out of control. इनका इंसुलिन डोज रिक्वायरमेंट ज्यादा है, उनका ब्लड प्रेशर कंट्रोल में नहीं आ रहा है क्यों मल्टीपल मेडिसिन, और हार्ट इज क्रिएटिंग सो मच अ प्रॉब्लम दैट वी नो दैट ही और शी कैन नॉट गो फॉर एन एक्सरसाइज राइट नाउ. सो टू हेल्प देम इन दैट वे वी डू अ बेरियाट्रिक सर्जरी. बेरियाट्रिक सर्जरी में क्या है मैडम, आपका जो पेट का जो साइज है काट के कम कर रहे हैं, जिसमें क्या है खाना कम ही जाएंगे, जैसे एक बच्चे का जितना ही खाना जाएंगे. सो यू आर नॉट ईटिंग मोर देन 50 or 100 ml at each sitting. But then what happens, this has its own side effects which will come up after a couple of years, because many of the nutrients and many of the other things क्या होते हैं वो deficiency में चले जाएंगे. So I would recommend bariatric surgery only for those who are morbidly obese, जिसका BMI इतना ज्यादा है कि and heart में problem है, diabetes is uncontrolled, BP problem है, stroke का problem है उनको, या age ज्यादा है उनको. Only those people. Going the natural way is always better. Because when they cut and chop your intestines, these are not some waste segments that you're cutting out, because ये body का जो भगवान जो बना के दिया है, it has, each segment has got a beautiful way of absorbing certain things. Like there is a portion called the duodenum where iron and other things are absorbed there. There is one part of the intestines where B12 is absorbed. Another part में है कि जो other nutrients like magnesium and other things are absorbed. So आप किधर भी काट पोक के निकाल देंगे, over a period of time, we have seen that these people develop deficiencies of all these nutrients. Like many of them develop B12 deficiency. आप बोलेंगे इसमें क्या फर्क पड़ता है B12 में? These people then develop nerve weaknesses. Sometimes they even come to the stage of paralysis, what is called as subacute combined degeneration. Many of the this thing vitamins like folic iron जो absorb नहीं होते, anemia develop होते हैं. तो आप एक solve करने को जाते हैं तो you will get multiple many other problems. So like I told you, go on a discipline. It should be an overall discipline in your life where that I have to reduce weight. So start with after you get a consultation with your doctor, you can always take the help of a good dietitian who will help you and guide you and motivate you rather that what to eat and how much you eat, so that a check is kept on what is the right time of eating, because right time of eating is also the thing. There's something called as chrononutrition. अभी लोग बोलते हैं ये टाइम नहीं मिला था, रात को 2 बजे खाना खाया. ये there should be some discipline in your life. This now we say it is called a circadian rhythm. जो body का जो biological clock is set in that way. That hormones भी आप body का देखो, वो जो production है आपको energy देने के लिए hormones produce होते हैं early morning में. By towards evening those hormones also come down. There are hormones which are secreted which want you to go to sleep. But क्या होता है, हमारा जो shifts है night shift रहते हैं, हमारा odd times रहते हैं. So we are now breaking that system. So we are actually inviting trouble for the body by breaking the biological clock.
Sir, nowadays more and more people are also going for protein drink, protein shakes and all. So how far these shakes and these protein drinks are going to affect the heart of the person?
So it's again a wonderful question, because most of the time you see these people, who want to build that extra muscle or extra body. They want to show, that 6 packs and 8 packs and all that, in this thing. So the gym trainers also recommend, up halana falana, you should take this particular drink. I'm not mentioning naming the companies also. They, recommend, and some of these protein shakes are phenomenally expensive, and I don't know what additional benefit they give. But they recommend, take these protein shakes, take this creatinine things, ye whey protein hai, ye hai, wo hai. They recommend so many things, and we find people literally replacing their meal with this thing, because they say that, hey doctor, these energy bars है, जो energy bars खाना है, या नहीं तो ये protein shake लेना है. But what they don't realize is the hidden problems with all these things. Many of these drinks or shakes have got what is called as a high mineral content. जैसे sodium content उसमें बहुत ज्यादा है, and some of them have got, abnormal fats in them, and they have many heavy metals and other things. So these indirectly will, what they do is, maybe you may lose your weight drastically for some time, but remember, you are not losing your fat cells. वो fat cells थोड़ा shrink ही हो रहा है, temporarily you are losing some weight, but these are causing damage to your kidneys and to your other organs. We have seen of late many of these people, when they come for some problem, we do their blood test. We find that, what is called as non-alcoholic liver disease. जो दारू पी के लोगों में जो फैट कलेक्शन होते हैं जो लिवर के अंदर, and that later goes to cirrhosis. Similar effect we are seeing in many of these people who follow these fancy diets. Because I told you, home cooked natural food nothing can replace, because there is a balance of carbohydrates, proteins, fats, minerals, nutrition, everything is balanced. But when you are now going to an eccentric diet, where you have high quantity of these proteins, and because they have so many things which are much, much more harmful. And I would not personally recommend, nor I don't think any standard or qualified doctor would recommend such shakes or such this thing to patients to lose weight. You have to be consistent and persistent in what you're doing.
Thank you for sharing such an important information, which is badly needed, especially to our younger generation today. So thank you very much, sir. दोस्तों, हम इसी तरीके से आपसे मिलते रहेंगे, कोई ना कोई इम्पोर्टेंट और नया टॉपिक आपके साथ शेयर करते रहेंगे. आप हमारे साथ जुड़े रहने के लिए हमारे चैनल को सब्सक्राइब कीजिएगा. हम फिर मिलते हैं. थैंक यू.
Thank you.